Welcome to this introduction to health. Today, we will explore the concept of health from various perspectives and understand the factors that influence our well-being. Health is a complex and multifaceted concept that extends beyond the mere absence of disease. Throughout this presentation, we will delve into definitions of health, the factors that control our health, and the steps we can take to maintain a balanced and healthy life. There are many definitions of health, and each offers a unique perspective. The World Health Organization, or WHO, defined health in 1947 as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition was revolutionary for its time because it recognized that health involves more than just the absence of visible disease. However, the phrase state of complete has been criticized for setting an unattainable standard. In 1967, Halbert Dunn offered a different perspective, defining health as an integrated method of functioning oriented toward maximizing the potential of which the individual is capable. Dunn's definition emphasizes that health is relative and depends on the individual's potential, acknowledging that each person's health status can be different. René Dubos, in 1968, expanded on earlier definitions by including emotional and spiritual dimensions of health, describing it as a quality of life involving social, emotional, mental, spiritual, and biological fitness resulting from adaptations to the environment. This introduces the concept of reciprocal determinism, where our behavior and environment influence each other. In 1979, Godfrey Hochbaum took this idea further by defining health as what enables a person to be what they want to be and do what they want to do. This definition makes health an individualized phenomenon, tailored to each person's desires and capabilities. Finally, in 1984, Richard Ebers developed a model of optimal health as a balance among physical, mental, emotional, social, spiritual, and vocational states. Ebers' Health Cube model emphasizes the interconnectedness of these dimensions, suggesting that a change in one area can affect the others. Throughout this course, we'll use Ebers' definition as our guide to understanding health. Now that we've explored various definitions of health, let's discuss the concept of locus of control. This refers to an individual's perception of who or what controls their health. There are three types: internal, external, and chance. People with an internal locus of control believe they have control over their health through their actions and decisions. In contrast, those with an external locus of control attribute their health status to factors outside their control, such as genetics or the environment. The third type, chance, relates to the belief that health outcomes are a matter of luck or fate. Health is influenced by both micro and macro factors. Micro factors are individual characteristics, such as behavior, beliefs, and attitudes. These are under your control and directly affect your health. Macro factors, on the other hand, include external elements like socioeconomic status and living conditions, which are often beyond your control but still impact your health. Focusing too much on micro factors can lead to unrealistic expectations about our control over health outcomes. If we don't meet our health goals, we might blame ourselves, even when other factors are at play. It's essential to set realistic and attainable goals to avoid self-blame and recognize the role of external influences on our health. On the flip side, focusing too much on macro factors can lead to rationalization and the use of defense mechanisms. It's important to recognize external influences on health, but not to use them as excuses for poor health behaviors. The key is to find a balance and understand both what we can and cannot control in our pursuit of health. Health is a lifelong process that involves self-assessment and medical assessments. Self-assessment involves observing how you feel and noticing any changes in your health. Medical assessments include health histories, physical exams, and lab tests, providing a more thorough understanding of your health status. Health histories are essential tools for understanding your health risks. These histories include questions about your dietary intake, physical activity, tobacco, alcohol, drug use, and sexual practices. It's crucial to be honest when providing this information to ensure accurate assessments and the best possible care. Physical exams typically start with basic measurements like height, weight, and blood pressure. Depending on your health history and other factors, The doctor may conduct additional exams to check for specific conditions. These routine checks are vital for early detection and prevention of potential health issues. Lab procedures, such as blood tests, urinalysis, and imaging, help doctors diagnose or confirm any suspected health issues. These tests provide valuable information that can guide further tests or treatments if needed. As we conclude, it's important to understand the factors within your control. Modifiable risk factors. These include behaviors like alcohol and drug use, physical activity levels, sleep habits, and social ties. By making conscious decisions to improve these areas, you can significantly impact your health and quality of life. However, some risk factors are beyond our control. Non-modifiable risk factors. These include family health history, exposure to environmental pollution, and past traumatic events. While we can't change these factors, it's even more important to manage the aspects of health we can control. So what can you do to maintain good health? First, know your health by paying attention to your body and its signals. Keep good records, as thorough documentation can help health professionals provide better care. Lastly, make good decisions. By practicing preventive behaviors, you can enjoy a healthier, longer life.